Hello everyone, my name is Carlos Ramirez, BlueBox CEO, and today I want to talk about a very important topic. Over the years, many members of the expat community have asked me some questions about how does the Ecuadorian Social Security system works. Today, I want to explain the story of the IESS, how much people used to contribute, how much people contribute today, the challenge with pensions, why there are sometimes shortage of medicines and specialists, and most importantly, how foreign people living in Ecuador can protect themselves properly. Let's start with the basics. What's the IESS? The IESS, which stands for Instituto Ecuatoriano de Seguridad Social, is the Ecuadorian's national social security system. It provides several benefits: public health care, retirement pensions, disability coverage, maternity coverage, work accident insurance, and the system works under a solidarity model. This means that workers today finance the pensions of retirees today. So, the system depends on one key factor: enough contributors to support retirees. When that balance breaks, the system begins to face financial pressure. Let's talk about history of Social Security in Ecuador. Ecuador's Social Security system was officially created in 1928 during the presidency of Isidro Ayora. At that time, it was called Caja de Pensiones. The system initially covered only a small group of public employees and urban workers. Later, reforms expanded the coverage. In 1970, the institution evolved into what we know now as IESS. For many decades, the system worked relatively well. Why? Because the population was younger, there were fewer retirees, life expectancy was lower, but as Ecuador developed and people began living longer, the financial pressure on the system increased. How much did people contribute before? Historically, the contribution structure has changed several times, but the basic formula has remained similar. Workers contribute a percentage of their salary and employees contribute another portion. For many years, the contribution structure was approximately employee contribution around 9% of salary, employer contribution around 11% salary. Combined contribution, about 20% of the employee's salary goes to the Social Security system. These contributions fund healthcare services, pension reserves, disability funds, and administrative costs. How much is contributed today? Today, the system works in a very similar way. The current contributions are approximately employee contribution, 9.45% of their salary, employer contribution, 11.15%, total contribution, 20.6% of salary. For example, if someone earns $1,000 per month, about $206 per month goes into the IESS system. For foreigners who are self-employed or retired, there is also an option of voluntary affiliation, where they contribute a percentage based on the declared income, or also they can consider the Ecuadorian basic salary and they will pay 17% from the Ecuadorian basic salary. It will be the cheaper way to join the IESS. Consider a voluntary a payment from the Ecuadorian basic salary, 17% from the Ecuadorian basic salary. This allows access to the public health system, and if you need, pension benefits also are available. Now, the pension problem. One of the biggest challenge facing the IESS today is the pension system. Remember, the solidarity model I mentioned earlier. Workers today finance retirees today, but several demographic changes are affecting this balance. First, people are living longer. Life expectancy in Ecuador has increased significantly over the last decades. This is one of the most important reasons, to be clear, because people are living longer. Second, the number of retires is growing faster than the number of contributors. Third, many workers operate into the informal economy, which means they do not contribute to the system. Today, economists estimate that Ecuador has millions of informal workers, meaning they do not pay into Social Security. This creates a structural imbalance: fewer contributors, more retirees, higher pension obligations, and as a result, the IESS pension fund has faced serious financial pressure in recent years. Now, let's talk about what happened during the Correa administration, because it's very important. Another important moment in the history of the IESS happened during the presidency of Rafael Correa between 2007 and 2017. During those 10 years, during this period, the government implemented several reforms related to the Social Security system. One of the most controversial changes was the elimination of the 40% government contribution to the pension payments. Historically, the Ecuadorian government was responsible for covering 40% of the pension costs. This was meant to support the sustainability of the system. It helps a lot. However, during the Correa administration, a reform removed that obligation. This meant that the IESS had to assume a larger financial burden to pay pensions. There were also debates about the use of the IESS funds to purchase government bonds, which some analytics argued reduced the liquidity of the system. Those decisions have been widely debated in the Ecuador and continue to influence discussions about the sustainability of the pension system. Now, why are there a shortage of medicines and specialists? Many people ask why there are sometimes shortage of medications and long waiting times for a specialist into the IESS system. And there are several reasons. Let's talk about that. First, the system serves millions of patients, which creates extremely high demand. Second, public procurement process can be slow. Hospitals must follow government purchasing procedures, which sometimes delay the supply of medications. Third, there is a shortage of certain medical specialists in the public system. Specialists such as cardiologists, neurologists, orthopedic surgeons, oncologists often prefer to work in private hospitals, where working conditions are compensations can be better. Fourth, administrative inefficiency and bureaucracy can also affect the speed of service delivery. For this reason, it is common for patients to experience long waiting times for specialist appointments. Regularly meet a general practitioner doctor can be faster, but when you need a specialist, you need to wait first to go to meet a general practitioner doctor. He will request some tests, and then he will determine if you need or not a specialist. Then it will be a delay, and it also will be a reason to wait long waiting times to see a specialist. Now, what do many expats do? Because of these realities, many expatriates living in Ecuador adopt a hybrid strategy. What it is? They may choose to be affiliated with the IESS system, but they also maintain a small private health insurance plan as a supplementary plan that will help to cover small emergencies, faster access to specialists, diagnostic tests, private hospital services. Then, using the private system, you will be able to access to all those type of medical needs and will be covered privately and faster. And if something bigger, something important happens, the IESS will work as your supplementary plan or major medical plan. Then you will be able to use the IESS in major needs. Those plans, those smaller plans, do not necessarily have to be expensive. Even a small supplemental health plan can make a big difference when it comes to accessing care quickly. To give you an idea, a broken arm can be assessed in hours, or probably IESS can refer you to other hospitals. Remember, IESS works only with public hospitals. Then sometimes when you go to the emergency room and a lot of people are there waiting, you will need to wait and wait and wait. If you have a supplementary plan, you will have access to private clinics and faster medical service. Ecuador remains an incredible place to live, retire, and enjoy life. The healthcare system offers both public and private options, and understanding how they work allows you to make better decisions for your health and financial security. The key is being informed and planning ahead. Remember, private insurance doesn't have a limit age in Ecuador. Then everybody can access to smaller plans and combine with the IESS. Finally, if you found this information helpful, I invite you to subscribe to this YouTube channel. In the next video, I will explain step by step how foreigners can affiliate to the IESS system, and also how to cancel or leave the system if you need it. Many people don't know this process, and it's very important to understand it before making a decision. Also, remember that as insurance brokers, we can't represent people under the IESS system. All this information I am giving to you as an informative video. And well, thank you for watching and welcome to Ecuador. See you on the next video.